Good afternoon. I'm Congressman Richard Hudson, and I'm honored to be joined by Senator Thom Tillis. We're here to talk about a serious issue impacting our state and our nation: military active duty and veteran suicide. As Fort Bragg's congressman and representative of the fastest growing veterans population in the nation, this issue is too important for my community and our state, and tragically, it's getting worse. Suicides among Army active duty forces jumped 46% last quarter compared to the same period last year. In the second quarter of this year, 60 active duty Army personnel lost their lives to suicide compared to 41 the previous year. Additionally, the number of U.S. military personnel active and reserve who died from suicide was 139 compared to 130 during the same period last year. Overall, suicides in the armed forces jumped 15% last year, 580 compared to 504 the prior year. For context, the total number of military personnel who've died from the coronavirus is 67. For veterans, deaths by suicide among those who served post 9/11 are 4 times the number of those killed in Iraq and Afghanistan. According to a recent report from Brown University, 30,177 active duty personnel and veterans who served in the post 9/11 wars have died by suicide, compared to 7,057 killed in war operations. The statistics are particularly troubling among post 9/11 veterans and service members between 18 and 34 years old. Their suicide rate is 2.5 times that of all civilians. In a poll of veterans who served in Iraq and Afghanistan, 2/3 who responded knew a post 9/11 veteran who'd attempted suicide, and 62% knew a post 9/11 veteran who died by suicide. Slightly less than half, or 44% of the respondents, said they had experienced suicidal thoughts themselves since joining the military. Overall, more than 17 veterans commit suicide every single year. Now, that's down from a peak of 22 a day in 2017, but it's still much too high. However, this latest figure is from 2019, which means we still don't know the true impact of the COVID-19 pandemic or the failed withdrawal from Afghanistan on veteran suicide. The data is staggering, and each number represents an individual and a family. So first, let me just say, if you or someone you know needs support, please call the Veteran Crisis Line at 1-800-273-8255. You can also text 838-255 or visit veteranscrisisline.net. This 24/7 confidential line is an important tool to combat this epidemic. But we must do more because our veterans and our troops are facing strains like never before. This year has not been easy for our veterans. Much of that stems from witnessing the botched withdrawal of Afghanistan that tragically led to the death of 13 service members. 2 of the 13 were connected to our state. Marine Corps Sergeant Nicole G. was from Sacramento, California, but stationed at Camp Lejeune. And Army Staff Sergeant Ryan Knaus lived in Pine Bluff, North Carolina, and was stationed at Fort Bragg. The horrors of the terrorist attack that took their lives, as well as seeing the Taliban with American military equipment, and the fact that we left Americans and our allies behind, infuriates all of us. But it caused a deep pain among many of our veterans. Consider that from August 13th, we've seen a vast increase in the calls, chats, and texts to the crisis line. And before I hand off to Senator Tillis, I just want to say directly to those veterans who served in Afghanistan, your sacrifice mattered. You did your job. You kept us safe from terrorism for 20 years. Our country loves you, and we're proud of you. And now I know Senator Tillis feels the same way, and there's really no better fighter for our veterans, our troops, and their families than Senator Thom Tillis. He's always been there for Fort Bragg and the other military installations across our state. So Senator Tillis, thank you for joining me today.
Thank you, Richard, and thank you all for joining this press conference. I'll be brief, but we've got to look ahead and recognize that this truly is an epidemic. Suicides, particularly among post 9/11 veterans, is simply unacceptable. And there are a number of things that we can do that I think will make a real impact. The things that we're already doing, and I'll talk a little bit about outreach in a minute, but the things that we have to accelerate. A lot of those 911, post 911 veterans may have been discharged with an other than honorable discharge. Oftentimes they're lost in the healthcare system. We need to go back to those records and really distinguish between veterans who had a behavior that clearly warranted a discharge, and veterans who may have been discharged just because their behavior changed as a result of PTS, traumatic brain injury, or some other battlefield wound, either visible or invisible, that's causing them to go into suicide crisis. The other thing we have to do is the stigmatization of behavioral health or mental health problems is a problem across the world, and certainly here in the United States, but it's even more so with men and women who serve in the military. They feel hesitant to actually share their vulnerability. They don't seek help, and we have to get them to the right people who can provide them counsel and get them out of crisis. And I do think that the failed Afghanistan withdrawal has already, I have firsthand knowledge of a Marine that my office was working to get an interpreter that he had worked with out of the country, and he was fighting desperately to do it. And unfortunately, he took his life before we actually got that particular person out. So I think we have, in the holiday season, post-Afghanistan, we have to redouble our efforts to make sure we can save as many of these men and women as possible. We have to expand access to health care through telehealth that worked during the COVID pandemic. But we also need to start right now. On November the 21st, which is Outreach Day, if you know somebody who may be in crisis, somebody who may need help, reach out to them and check on them. Don't diagnose them. Don't come up with a solution. Let them know it's okay to recognize this as an illness like any other illness, and there are medical professionals in the VA who stand there to help them. So thank you all for being here, and we turn to questions.
Absolutely.
Yes, Senator and Congressman, this is Ruben Jones from Spectrum News. Can you hear me okay?
Yeah, Ruben.
Hey, Ruben.
Two quick questions for you. The first, I wanted to see President Biden laid out some steps to combat veteran suicide a couple weeks ago, including some of the things you talked about, increasing access to mental health resources, suicide prevention research. I wonder what type of impact you think those changes might have, and if there's anything else you'd like to see included in that package.
Well, I will just say we had an oversight hearing recently on veteran suicide with the Department of Veterans Affairs, and any ideas, I'll take all comers in terms of suggestions, but we really have to accelerate the pace. So, Ruben, one thing we need to do is just early interventions. While we're trying to come up maybe with systematic changes, we need to recognize that we had some bright spots, I should say, during the COVID pandemic. One of them was actually telemedicine outside of the VA. There was one pilot down in North Carolina where there was an area set aside at a Walmart where someone could come in and get health diagnosis, but it was also for mental health, anyone who needed to speak with a doctor and then figure out their next course of care. So I've seen the proposals. I'm aware of several efforts that have been going on actually since I started here with under President Obama, President Trump. They've all made it a priority, but what we have to do is get to an outcome that bends the curve on veteran suicides. And so I welcome the suggestions, but I'm all about the details of implementation. In my capacity on Veterans Affairs, I'll be working to that end.
And I agree with Senator Tillis. You know, I welcome President Biden and the administration and their work on this issue. I think, you know, put an emphasis on it's important, and I'll work with anybody. I am a little concerned with the proposal, as I've seen it, that it focuses a little bit on gun control. I think we need to focus more on the whole person and really trying to get into root causes and really getting care to these individuals. And again, I appreciate you, Ruben, and the others on the call today helping us get the word out about November 21st being the National Warrior Call Day. And we just want to encourage individuals to reach out to someone they know, active duty or veteran, and just check in on them, just to have a conversation. Because what we've seen is the most powerful medicine, if you could use that term, is one person checking on a buddy. Someone reaching out to someone who they've had a similar experience with is very powerful. And so we appreciate you helping us get the word out.
And if you don't mind, if you'll indulge me with one unrelated question related to the bipartisan infrastructure bill. Senator, obviously you were voted for it, were a proponent of it. Congressman, you did not vote for it. I just wonder, Senator, were you surprised that more House Republicans didn't get on board with this? And do you think it would have been any different if the vote came up earlier in the fall than it did this month?
Well, I think it's just another example of Speaker Pelosi's mismanagement of her chamber. So I'm not going to get into the details and maybe why one person would vote for it or vote against it. But what I do know is that Speaker Pelosi now has the challenge of convincing conservative Democrats that they should go after this tax and spending spree bill that they're getting scored this week by the CBO. And it's not going to be a pretty picture, despite what President Biden says, that it's all free.
Thank you.
Senator, Congressman, this is Cullen Browder from WRAL. We had a story last week where we spoke to a mother whose son, an Army captain at Bragg, came back last year from Afghanistan, ended up taking his life. She's very critical of the military's reintegration, reorientation efforts, or in her view, the lack thereof. I'm curious if you've heard that from your constituents, and is this something you feel like needs to change, and if so, how?
Well, I can tell you that working on the VA and working on Senate Armed Services, the one thing that I continue to focus on is they call it TAP, Cullen, the Transition Assistance Program for people who are transitioning out of armed services. I don't think we do a good job. We have people in a room, we have programs that are not designed to the individual and the unique circumstances that some of those individuals experience. If you had somebody who was deployed once or multiple times in Afghanistan or Iraq, you really need to understand their history. You need to understand what they were exposed to. How many active fighting engagements were they in, whether or not they were exposed to a burn pit, whether or not they got injured, whether or not they saw a friend die beside them. All those are things that speak to a risk. And then you also have to take a look at what can they do once they separate. Job skills, education, and track them, not at the end of TAP and say, check in with us if you need help. We need to follow that soldier, sailor, Marine, airman, all the way through to the point to where we know they're independent, they're in good mental and physical health, and that's something that we're falling short of, and something that there's probably not an oversight hearing that goes by that I don't continue to pound on it. I believe the departments get it, but like I responded to Ruben, it's all about execution. We have to see a plan that gets the transition assistance program down to an audience of one. That one soldier, that one sailor, Marine, and airman, and make sure that we give them the right information when they transition, but we track their progress over time.
Thank you.
Senator and Congressman, thank you for your time. My name is Lucy, and I'm at Channel 12 in Jacksonville, where Camp Lejeune is based out of. And I am just wondering, you said that we need to focus on the individual. I'm wondering how you plan to go about this, if that means funding for organizations, nonprofits, or state funded, or the VA that are already in place, or if that means creating new organizations in areas. And I'll ask a follow-up after this question.
Go ahead.
We already have the foundation in place. A few years ago, the Department of Defense implemented a new electronic health record that is state-of-the-art, and the VA is in the process of implementing the same electronic health record. What we need to do on the Department of Defense side is make sure that we're capturing all of these things, that through analytics, we may be able to identify someone's at risk before they even know that they are. Just think about chaining together. It could have been an accident that happened in basic training. It could have been a burn pit exposure. It could have been witnessing carnage in a deployed situation. It's tracking all of those things and using analytics and science to say, this is somebody that we certainly need to talk about, check their health and well-being, and give them the ability to actually get ahead of treating the disease or the mental health problem they may have, or physical health problem for that matter, before they know they even have it. And then, once they transition, I want to be convinced that every byte of information that was captured in the DoD database is completely transferred to the VA database and available to the 40% of medical professionals outside of the VA that provide care for our service members after they exit the military. If we do that, You can use a lot of existing information. You would have to invest some in analytics, but it's basically building on some investments that have been made over the past 2 administrations.
I agree with the senator, and I think it also involves the physical side too. Tracking the types of injuries that they may have been involved in, exposures to blast. We're invested in research now with UNC Chapel Hill on brain injuries, and understanding that we've gotten to a point now with TBI where we can predict certain behavioral problems based on the place a person was injured in their brain, and so the more science we can get behind that, and the more data we can collect on these individuals, I think we can get ahead of this and do a better job.
And I think if you take a look at the suicide rate among veterans, a significant number of them have what's called bad paper, an other than honorable discharge. I think if we invest in the VA and get better understanding to the extent we can of that service member's life events like Richard just talked about, we may want to go back and revisit some of the eligibilities. We've already made mental health access available to anyone regardless of their discharge outcome, but I think we have to go back and look a little bit further. This is all about repaying a debt we'll never fully repay.
All right. Well, thank you everyone for joining us today. And again, we really appreciate you helping us get the word out. We can really have an impact. I was on the radio in Fayetteville a couple months ago, and I gave out the hotline number, the crisis line number, and we found out a month later that a veteran was literally listening to me on the radio, contemplating suicide, and yet called that number instead, and we were able to save a life just by providing that number. So if you could help us share the crisis line number and share the information about the Veteran Call Day on the 21st, we'd really appreciate it. Thank you all.